Hello again, I'm Joel Barthelemy. The goal of Connected Health, what we call telemedicine, is to produce a complete medical record for each patient, no matter which healthcare provider they see, when they see them, or where. The urgent care center movement began in the 1970s to provide after-hours access to primary care as a less expensive alternative to emergency department care. Until now, there has been little guidance on the use of telemedicine in urgent care centers, sometimes called retail care clinics. And too frequently, patient medical records with their primary care physician or medical home fail to reflect visits to the urgent care centers. A task force deployed by the American Telemedicine Association, or ATA, has developed practice guidelines for real-time, direct-to-patient primary urgent care telemedicine. These will be available in draft form for public comment on the ATA website until June 22nd. The guidelines define a virtual or connected health visit as a communication between a provider or healthcare system professional and a patient by telephone, cell phone, and/or standalone video conferencing technologies. Such an encounter in an urgent care center can provide medical consultations, diagnoses, and treatment for both acute and chronic conditions that are not life-threatening. The difference between urgent care and primary care, according to the guidelines, include expectation of follow-up, ease of being seen in a timely manner, continuity of care, and developing a trusting relationship. The guidelines establish circumstances appropriate for patient visits via video conferencing. Before a telemedicine encounter, the guidelines say that the healthcare provider or entity shall inform and educate the patient of all pertinent information regarding it. Among the key topics that shall be covered by this exchange of information include confidentiality and the limits to confidentiality in electronic communication, an agreed upon emergency plan, and the process by which patient information will be documented and stored. To meet the standards, the distant provider should obtain an accurate account of the patient's current condition and medication and/or treatment history. And the provider and the patient should be able to communicate using the telecommunications modality used during the encounter. For confidentiality reasons, both the patient and the provider should be in an environment that ensures privacy so a clinical discussion cannot be overheard by others. Healthcare licensees must follow all federal, state, and local regulations and shall abide by training requirements. They should practice evidence-based care whenever possible and to the extent supported by the medical literature. The guidelines do leave it up to the provider to determine if a video-based visit is required or appropriate, as well as what portion of the exam needs to be documented. The guidelines also leave open the method of examination, stating that it may be possible to establish a doctor-patient relationship through video or telephonic means. For example, Alaska lawmakers recently approved a measure allowing telephonic exams alone to establish the relationship. But the 49 other states either require an in-person exam or an electronic exam with video conferencing. The guidelines list routine conditions and whether they are appropriate for telemedicine management by telephone only and those by video. The urgent care telemedicine guidelines are available for public viewing on the ATA website, americantelemed.org. If you have trouble finding them, send me an email and I'll send you the link to the guidelines. My email address is Joel's blog, that's JOELS blog, at globalmed.com. It's also on the bottom of the script on the web page. I'm Joel Barthelemy.